Hi, my name is Olivia and I am a nursing student at the University of Michigan. I am going to present a patient to you today. The patient is a 57-year-old Caucasian male. He is married with 3 children and is employed full-time as a restaurant manager. He presents with the chief complaint of leg pain. 3 weeks ago, he was doing some lifting and noticed the onset of lower back pain and a left anterior leg pain, as well as numbness and tingling in the left leg. He has been treating the pain with 5 200-milligram ibuprofen tablets about 4 times per day, which he states did not help. Sitting and driving worsened the pain. The patient describes the pain as a strong ache. It is intermittent and it is getting worse. He now rates his pain at about an 8 out of 10, with the leg pain being more unbearable than the back pain. The patient states that he had a very similar experience in the year 2009. He was diagnosed 7 years ago with 2 herniated discs, one between L4 and L5 and one between L5 and S1. He received 2 epidural steroid injections and reports that the pain subsided and he has been doing very well. All of the patient's immunizations are up to date. He claims to have no known drug or environmental allergies. Past hospitalizations include a double hernia surgery in 1989, a knee surgery to repair a torn meniscus in 2000, and a mild concussion in 2012. Current medications include 12.5 milligrams of Hyzar taken orally once a day for hypertension and 20 milligrams of Lipitor taken orally once a day for high cholesterol. He has been taking these medications since diagnosed with blood pressure and high cholesterol in 1997. The patient denies the use of tobacco or illicit drugs. On the weekend, he drinks around 2 alcoholic beverages. He gets an average of 7 hours of sleep every night and drinks 2 cups of coffee each day. He recently changed his diet by cutting out white sugars and white flour and has lost about 15 pounds over the last month. The patient is happily married and has a good support system of friends and family. However, stress seems to be a huge component in the patient's life. His father has been in and out of the hospital battling cancer, which has put a large strain on him. Daily, he experiences tremendous stress at work and often carries this stress throughout the day. The stress does not necessarily keep him up at night, but he will wake up early in the morning and not be able to fall back asleep. He also states that the weight loss may be attributed not only to the diet, but to stress as well. The patient's mother and father are still living at ages 88 and 83, respectively. His father has a history of migraines and prostate cancer, which metastasized to his bladder and then to his kidneys. The patient has 2 sisters, ages 59 and 52. Both have had breast cancer. The patient has no further remarkable family history. The patient does not experience any fevers, chills, or night sweats. He does not report any heat or cold intolerance, nor any excessive fatigue. The patient states that he has inherited his father's migraines, but experiences optic rather than the traditional cranial migraines. During periods of extreme stress, the patient notices numbness in the shoulders and tunnel vision in the eyes. These optic migraines happen about once a week, depending on stress level, and last about 5 minutes. Although his doctor describes this as normal, the patient is aware that experiencing such high levels of stress so often is not normal nor healthy. He states that although he knows this, sometimes being aware of the stress gives him even more anxiety. The stress in the patient's life is important to note because it may be a factor not only in his hypertension but in his lumbar myelopathy and sciatica. Aside from the abnormally high stress levels, the patient describes himself as generally healthy and is working to make lifestyle changes that give him more day-to-day ease. The patient's vital signs were all within normal ranges. Blood pressure 122/83, pulse rate 74 beats per minute, respiratory rate 18 breaths per minute, and temperature 98.2 degrees Fahrenheit. Because the patient had complaints of pain in the lower back and left anterior leg, I chose to begin with a musculoskeletal exam. The patient reports no joint abnormalities aside from swollen knees after full days of work. He does not report a lack of range of motion. He has noticed no muscle weakness and has no history of arthritis. His leg and back pain, however, hinder his ability to lift, drive, and both relax and stay active. Muscle mass and bone structure are normal and symmetrical. Posture is erect. Gait displays stiffness in spine and knee, but the patient seems to loosen up after a few steps and states the stiffness only occurs after long days at work, followed by long periods of sitting. The patient shows no signs of scoliosis. Examination of the temporomandibular, neck, shoulders, elbows, wrists, fingers, hips, knees, and ankles reveals no evidence of tenderness, erythema, warmth, pain, or crepitus, and all display no significant limitations in range of motion. Lumbar motion is about 50% of normal. Deltoid, bicep, tricep, wrist, finger, hip, hamstring, quadricep, and ankle muscles are equal in strength bilaterally and graded 5 out of 5. There is no evidence of atrophy. Because of the patient's complaint of tingling and numbness in the left anterior thigh, I also chose to give a neurological exam. The patient has no concerns of memory or concentration impairment. He has not experienced any loss of balance or difficulties with speech. Stress and anxiety affect his daily activities and occasionally cause insomnia. The patient reports no tingling or numbness outside of his left anterior leg or his shoulders during his optic migraines. He has never had a seizure and does not experience any loss of consciousness. His only history of head injury is a mild concussion 4 years ago. Upon examination, the patient does not appear anxious. Mood and affect are unremarkable. He appears well-groomed and well-nourished. He appears his own age. He is alert and oriented to person, place, and time. The patient shows no abnormalities in attention span, abstract reasoning, intellectual ability, judgment, or thought process. His speech is clear and vocabulary is appropriate to his age and intellectual level. There is no evidence of short-term or long-term memory loss. The patient shows no loss of balance and no disturbances of the vestibular apparatus. Motor coordination is normal as shown through rapid alternating movement testing of the upper extremities and fine motor function testing of the upper and lower extremities. Patient reports full and symmetrical sensation to light touch, painful stimuli, and vibratory sensation. Cortical and discriminatory sensation is intact as demonstrated by normal stereogenesis, graphesthesia, and proprioception results. The Babinski sign is negative and no ankylosing is noted. Another system that would be important to assess for this patient is the genitourinary system. The patient reported that his father has had prostate cancer, and according to Zheng et al., specific single nucleotide polymorphisms have proven to be associated with prostate cancer prevalence. Because DNA is simply passed down from parent to child, the patient may have likely inherited the same SNP mutations that led to his father's prostate cancer. The specific cancer is infamous for being one of the most hereditary, and many men with a family history of prostate cancer opt for a blood test that can tell them whether they too have mutations on any of these particular genes. The patient was unfamiliar with this information, and although he receives a full physical exam annually, the genitourinary examination would be beneficial as a preventative measure to catch a possible prostate cancer early. Because the patient is currently taking medication for hypertension and reports having high cholesterol, it would also be important to assess the cardiovascular system. The patient reports experiencing a lot of stress at the workplace, and according to Rosenthal et al., there is a strong link between not only occupational stress and hypertension, but between stress and cardiovascular disease. Repetitive tasks, heat, and noise also contribute to job strain, and as the manager of a restaurant, the patient experiences all of these on a daily basis. Jobs with high demand and low rewards substantially elevate the risk for hypertension and cardiovascular disease. Apart from the direct physiological changes, stress can also have a strong impact on the activities of daily living. It can lead to insomnia and a tendency toward an unhealthy diet, both of which are strong contributors to heart disease. All of these contributing factors make a cardiovascular exam very beneficial for the patient.